Yeah, because if it's kind of, it attaches to the medial border, but the fibers go down this way, so it's going to pull it down like that. Okay? But what also it does is that it keeps the scapula from winging. Because if you have a weakness of the serratus anterior, what happens is the scapula is going to wing out in the back like this. So if you're looking at somebody, if they're trying to do a push-up like this, their scapula is going to wing out like that. Because it's attaching on this medial border, so it's pulling the medial border in like that. So the other thing you want to remember about serratus anterior is it's the one that, if you have a weakness in the serratus anterior, your scapula are going to wing out, which means they're sticking out towards the back. If you see from the back and that medial border is going to be more prominent, that's what this lack of the serratus anterior is looking at. And then you have the subclavius, which basically is just under the clavicle. And then we'll look at the pictures of these after we go through the diagnosis. Subclavius just means under the clavicle. Okay? So it's going to originate on the costal cartilage of the first rib. So it's coming off of the rib here, and then it goes to the undersurface of the clavicle. And then it's going to help to pull the clavicle down like that. It's not always that significant of a muscle, but just remember it's a subclavius, it's underneath the clavicle, it goes from the first rib over the clavicle like this and helps to pull it down like that. Okay, so now we have the trapezius. And then let me go to
Okay, I have a picture of it, but you can't see anything from where you are.
Yeah. So here it is right there.
Yeah, it's like that.
Actually, I think I have a better picture than go keep talking and I'll come back.
Okay, it's trapezius means irregular four-sided figure, and it's the most superficial of the posterior thorax. It's flat and triangular. And some of its actions are it stabilizes, it raises, retracts, and rotates the scapula. The inferior fibers of it depress the scapula. The origin is in the occipital bone, and the insertion is the elongate acromion and spine of the scapula, and then the lateral third of the clavicle.
So you said that the origin, though, it's more than just the occiput.
No.
That's the upper trapezius.
Oh, okay. And then the middle is the SPC7.
Right. Down into here, so we'll go a little bit lower. And then the lower trap is going to be down here.
And T4 thoracic 4 through 12.
Right, so yeah, the lower. Yeah. So if this lower trap is going to pull right here on the scapula, this, I'm looking for the back of my left scapula. Once again, is that going to upwardly rotate or downwardly rotate?
Upward.
Yeah, because if I pull down this way, because the fibers are running this way like that, if I'm pulling here, it's going to upwardly rotate. Okay. And then we'll go over the So like she said, okay, so the origin of the upper trapezius is the occiput and also the nickel ligament, and then SPs of C1 to 7. And then it inserts on the lateral third of the clavicle. So the upper trap kind of wraps around more to the front of the clavicle here. So it's coming around this way. And then you have the middle portion, which is going to go to the acromion here, and at the upper border of the scapula, of the spine of the scapula. So that's more towards the posterior part. The upper part is a little more to the front here, middle part here, and then the lower portion. Okay, is the TPs of C1 to C4, and it goes to the medial border of this gap between the superior angle and the root of the spine. So it's going to be more in this area here. And then the lower is on the inferior portion of the spinal scapula. Okay. So it's got to be downward rotation. So now you have levator scapula. So by the name of that, what's that going to do? It's going to elevate the scapula. Okay. And a lot of times that's where you can have a lot of trigger points, up in this area here. Okay. So then, in this case again, the origin is going to be more at the spine here. So you have the TPs from C1 to C4. It's going to be on the side of the spine here. TPs, and then it's going to go down to the superior angle of the scapula, on the medial border of it, actually. Okay. So that's going to be right here. Okay. So this is the superior border of the scapula, but it's on the medial side of it. Okay. And then it's going to elevate the scap, and when the scapula is fixed, then it can laterally flex and rotate the neck. So if you fix the scapula, the levator scapula can pull the neck down, laterally flex towards. All right. Then you have the rhomboids. Okay. And then that's going to originate from the SPs. The minor part is the upper one, which is C7 to T1. So that's coming from around in this area here. And that's going to go to the medial border of the scapula. Basically towards the root of the spine here. And then the major portion is going to go down all the way to the bottom of the scapula here. And then basically it's going to do scapular retraction and stabilization, and then also downward rotation. Because if the rhomboids are coming in at this angle here, so they're going to downwardly rotate. And they're also going to retract. All right, so now we'll talk about on the front part here, you have the pec major. Okay? And then you're going to have usually, I don't know if they refer to it here. Okay. So you have the origin, it's going to be the sternum end of the clavicle, and then the sternum, and then the cartilage of the first ribs here, first 6 ribs. Okay. And then that's going to go to the greater tubercle and the intertrabecular groove, or the bicipital groove. So remember we said that bicipital groove, or the intertrabecular groove, is between the greater and lesser tuberosity. So the pectoralis is going to be more towards the front of the humerus. And again, what's the motion going to be for that? What kind of rotation? Internal rotation. And you can get a little bit more detailed into where you talk about the sternal fibers of the pec. So that's going to run more this way. So like we'll get, if we have time when we do palpation stuff, we'll get into muscle testing. So if you do muscle testing for the clavicular fibers of this pec major, you're going to have, it's going to be more in this plane here. Because these fibers run more this way, right? So you can see that it's going to pull in this way. Okay? Whereas if you have the more of the sternal fibers, they're going to run more this way. So if you're going to muscle test that way, then you're going to do this kind of resistance. So this is more of the sternal fibers of the pec, and this is more of the clavicular fibers. So then it's prime mover of flexion, also medial rotation, and then adduction. But if you have a situation where the humerus is going to be fixed, like if you're doing pull-ups or something, then it's going to move this towards the humerus. So the actions are a little bit different if it's fixed. So it's going to be like climbing and pull-ups. Okay? So if you're reaching up and this part is more stable, then the pec is going to bring it up towards that.